Hey guys, Dr. Al here from inTune Chiropractic, coming at you with another video. This week we're going to be talking about ankle mobility and some exercise stretches and some things we can do in the office to kind of improve that mobility, and why having a decrease of mobility in your ankles might be causing some knee pain or hip pain or low back pain, or maybe kind of hindering your PR on your squats or deadlifts. So we're going to get into all that today. So first off, we're going to just kind of talk about the anatomy of the ankle and a couple of different things that could be going on that's going to cause that decrease in mobility, especially doing things like squatting and stuff like that. And before you stop watching the video because you're like, oh, I'm 80 years old, I'm not going to be doing any squats, you should be able to be 100 years old and doing squats. So if you're not, there might be something going on. Give us a call, let's evaluate you and figure it out. But first off, the main motion of your foot that can cause that decrease in mobility is called dorsiflexion. That's when you bring your foot up like this and bring those toes closer to the shin. So this is just normal, nice dorsiflexion. So one of the things that could be going on that could cause a decrease in mobility is called an anterior impingement syndrome. Basically, when you bring that foot into dorsiflexion, you feel a pinching sensation right in the anterior part of your foot. Normal dorsiflexion, normal movement like that is the tibia moving and gliding nicely over the talus, which is one of your ankle bones. The big ankle bone sitting right there at the bottom. So you want a normal, nice gliding sensation, moving the tibia over the talus. But when there's not, and there's a decrease in that motion, and you have a little bit of pinching or a little bit of pain in the anterior part of your foot, that mainly means there's a restriction going on in that joint space between the tibia and the talus. And by doing a couple of exercises, getting the ankle adjusted, we can kind of remove that restriction and get that full range of motion back in the foot. Another thing that could be going on is when you're moving that whole leg into dorsiflexion, you feel a lot of tightness in the back, in the calf, in the Achilles tendon right here. That could be Achilles tendinopathy. It could just be tightness in the gastrocnemius or soleus muscles in your calf. And by doing things like rolling it out, stretching it, soft tissue work, and just making sure that it's all around nice and loose, can restore that function back into the ankle and increase that ankle mobility. So you're sitting there and you're wondering, how do I test what's wrong with my ankle, or even if I do have some decreased mobility of the ankle? So I'm going to show you a quick, easy test you can do at home. I'm doing it in dress pants and a polo shirt. So if you're doing it in like some loungewear stuff, you're in a better position to do this than I am. But super easy. All you got to do is find a nice wall, get down on one knee, and place your leg just like this. And I'll show you everything in just a sec. Are you still filming? Okay. You started? Okay. All right. So what we're going to need you to do is kind of put your toes about 5 inches from the wall. A quick, easy way you can do this is kind of putting your palm down on the floor and then measuring your toes up just like that. So you want everything to be straight on the wall, and then without lifting your heel off of the floor, I want you to bring your knee slowly to that wall and touch it. See, this is great ankle mobility. This means that my heel isn't lifting off the floor, or I have no pinching sensation in the front part of my ankle. If you want to even test it, and if you really want to put this wall test to the test, you can go even further than 5 inches. Start going to 6 inches, then to 7 inches, then to 8 inches, and see how much mobility you can get in that ankle before you're actually feeling it, and really test that durability. So I'm about 6-7 inches away from the wall, and leaning forward, I notice that I'm starting to lift up on the back of my heel, meaning that I might have some tightness in my Achilles tendon or in my calf. But no pinching in the front part of that ankle, which means there's no anterior impingement syndrome, which means there's no decrease of or any restriction kind of in the front part of that ankle. Okay, so now I'm going to show you a quick kind of exercise that you can do if you fall into that group A category, or the group who has that pinching sensation in the front part of the ankle right here. So what I need you to do, get an elevated surface. This is better and more specific. Get a TheraBand or any kind of band you can get. The heavier duty, thick ones are usually better and get a better pull, but any band will do. And I want you to place that band on your talus, not on the shin, so right where that kind of foot crease makes when you do that dorsiflexion. And you can either attach it to a pole, attach it to a chair, attach it to a table, or have a partner kind of pull on the band, get nice tension in it so it's got nice pull on that talus, so that when you move forward, that tibia will get that nice non-restrictive glide over top of the talus. So what you're going to do now is kind of exactly like the wall test. You're bringing that knee forward to just about the point where you feel like your heel might be coming off of the table, and then hold for 5 seconds. Slowly return to the starting position, and then do it again. Hold for 5 seconds, and do that for about 20 reps. So I really want to stress that the band needs to be on the talus and not on the actual shin or the tibia bone to really get the most out of this exercise. Okay. So if you fall into group B, where you have tightness in that Achilles tendon or that calf muscle, here's a couple of quick exercises you can do to kind of really relax that. The first one is a drop ankle stretch. So what you're going to need to do is find a step, find a chair, find a little ledge. We don't have any in the office, so we had to come out into the parking lot and go on the curb. But what I want you to do is bring those ankles off as far as you can. This is a starting position, and I want you to drop and hold for 5 to 10 seconds. Getting a nice deep stretch in that Achilles tendon in that back of the calf. Bring it back up and then back down again, getting an even deeper stretch. Got to really stress those ankles, or stress the Achilles tendon, pulling on the ankle, stressing and stretching those calf muscles, and bring that up. And do that for about 10 to 20 reps just as the first exercise. And we're going to show you one more thing you can do. So another quick thing you can do to kind of release some of that tension in the Achilles tendon and in the calf is grab a trigger point ball, or you can grab a foam roller if you have one. We don't have one right now at the time, that's why I'm going to use my trigger point ball. But what I want you to do, lay on the floor, place the ball or the foam roller where that calf is in the Achilles tendon, wherever you feel is the most tight, and I really want you to roll it out. Back and forth, get nice and deep in there. It's a little uncomfortable, but it's honestly worth it. Move the leg around, get the different muscles in the calf, get the inside, and really dig in there with the ball or the foam roller. If you need a little extra tension, you can always bring your other leg on top of it and apply a little bit of pressure, and then it'll get even deeper into there. One thing we have in the office that'll help us really quickly kind of loosen up the calf, loosen up the Achilles tendon, is our Theragun. So what I'm going to show you is just kind of working it on the calf, loosening up these muscles as much as we can. Whew, a little uncomfortable, real tight in there, but it's honestly worth it. So for all you runners, we have a nice little runner's hack that we can use with either a foam roller or a trigger point ball. This one might be better with the trigger point ball, but I'm not going to tell you here. I want you to run over to our Instagram at inTune_chiropractic, and we'll show you a quick little video of how you can help with those shin splints and just have overall better running and have nice feeling in the legs while you are doing that running. But that's all for ankle mobility today. So like I was saying, if you're old and you can't do a squat, don't use your age as an excuse. Get in there, see what's going on. Maybe you have some decreased mobility in those ankles. Let's get those ankles evaluated and figure out what we can do to get you back to doing what you love. If you're exercising and deadlifting and squatting and things like that, and you just can't reach that extra potential, you can't add on those 10 more pounds that you need to get to your best PR that you've ever done, you might have a little bit of decrease of ankle mobility. Let's get you evaluated. Let's see how those ankles are feeling. Let's stop anything in the ankles before it moves on into the knees or into the hips or into the low back. Let's get everything as functional and moving as possible, and let's get all that restriction or tightness out of your musculoskeletal system and really help you reach that full potential. Thank you, guys. Real quick, guys, I want you to go over to our YouTube channel, which you should be on right now if you're watching this video. I want you to like and I want you to subscribe. It really helps support us. And if you haven't already, go follow us on Instagram, go like us on Facebook. And if you're in the Mount Juliet area or the Wilson County area in general, come stop by. Let us evaluate you. Let's sit down and just talk and see how we can help you reach your full potential. Thanks, guys. Talk to you soon.